Hello students, we are going to see unit 2 second video of mine, that is factors influencing pain. Last video we have seen biological factors and psychological factors. Now this lecture we are going to see social factors and impact of unrelieved pain. Now what are social factors that influences pain? Basically it can be divided into culture. We'll see first one by one. Uh, Culture shapes how pain is perceived and expressed and managed. Some cultures encourage stoicism. Stoicism means what? Not showing pain, while others openly express discomfort. So some cultures they say that you don't have to express your pain. So beliefs may influence the use of traditional healers, herbal medicines, spiritual practices, and instead of modern medicine. So some beliefs may influence the pain perception. For example, in some Asian cultures, verbal expression of pain may be minimized, while in Mediterranean culture, pain expression is more vocal and visible. So in that case, like you have to verbalize your pain. Going back to the family learning, it also has important factor in pain influence. Like pain behavior is often learned from family members. So if a family normalizes tolerating pain, individuals may underreport it because in family the culture is like that. So children often mirror parents' coping strategies. They look at their parents and they cope accordingly. So example, overreaction versus resilience. So supportive family presence can influence the pain. It can even decrease the anxiety and increase tolerance. Gender, as we have seen earlier also, gender also influences pain. So biological and social differences affect pain experiences. Women often report higher pain sensitivity because of their hormonal influences, menstrual cycle, childbirth experiences, whereas in men, they may underreport pain due to social expectations of toughness. So pain need to be more like you can say you have to uh, assess the pain, and men are more expected to tolerate the pain. Gender stereotypes can lead to underreporting and misinterpretation of pain in clinical settings. Ethnicity, this is also important factor of social, you can say, influencing factor. Different ethnic groups may perceive and communicate pain differently. Ethnicity means it influences the trust in healthcare, use of alternative medicines, and willingness to report pain. Healthcare professionals need cultural competence to avoid biases. Example, African American patients, they sometimes report under treatment to the pain due to care provider bias. Now, impact of unrelieved pain. This is last point what we are going to discuss. Basically, if the pain is unrelieved, it may have different impacts. First, it will have impact on physical effect. It can lead to increased heart rate, blood pressure, and respiration. So, patient may have tachycardia, tachypnea, and hypertension because of unrelieved pain. Suppressed human function also can happen. Impaired wound healing also can happen because of unrelieved pain. Muscle tension, fatigue, sleep disturbances. Next is impact of unrelieved pain. Psychological effects. Anxiety, depression, irritability, loss of control, helplessness, decreased motivation for recovery, risk of substance abuse if pain persists, or if it remains untreated, definitely patient will go for substance abuse or misuse. Patient will go for alcoholism, smoking, tobacco. So all these will increase in patients. Then social and other effects. If it is unrelieved, then it may interfere with the daily activities, work and relationships, reduce social interaction. Patient will try to avoid social interaction. Patient will remain in isolation. Economic burden also will be there on family. Treatment cost, loss of wages. So strain on family caregivers also will happen. If it is unrelieved, then it will definitely have impact on acute pain on recovery, delayed mobilization after surgery, longer hospital stays, higher risk of complications, basically pneumonia, deep vein thrombosis. All these are the complications that are going to happen if it is unrelieved. Reduced quality of life, definitely it is going to hamper the quality of life, slower rehabilitation process of the patient. And last one is development of persistent, or it is called as chronic pain. If it is unrelieved, then definitely patient will have chronic pain. Uncontrolled acute pain may sensitize the nervous system, leading to chronic pain syndromes. Example, post-surgical chronic pain, phantom limb pain or sensation, you can say. Chronic pain becomes more complex to treat and may cause lifelong disability. So lifelong patient will be complaining of pain. So in short, we have seen the factors influencing pain in these two lectures, two videos. I mean to say, pain is influenced by biological and psychological factors. In one video we have seen, and in this video we have seen social factors and unrelieved pain, what impact it will have, especially on physical, psychological and social burden as it is. So mainly take home message is what nurses must ensure timely assessment and management. And definitely pain is inevitable, but suffering is optional. So suffering is up in our hands, how we suffer, how you take it. These are the references what I referred.